You've heard all these COVID numbers swirling around the news, but what do they really mean, and how are they determined? Anastasios Nicholas Angelopoulos, Reese Pathak, Rohit Varma, and Michael I. Jordan take on one of these COVID numbers, the case fatality rate, in their HDSR paper on identifying and mitigating bias in the estimation of the COVID-19 case fatality rate. They outline different data biases that could result in inaccurate estimation of a particular quantity of interest, and then propose a new way of estimating the case fatality rate that accounts for a particular kind of bias. There are a lot of moving parts that can impact the estimation of the case fatality rate. The authors of this paper try to organize these parts as a graphical model displayed here. The goal of this video is to unpack some of the effects outlined in the paper and make some of the decisions that a statistical modeler makes to try to mitigate bias more accessible. Let's unpack.
COVID is impacting the whole world. The whole population is at risk of contracting the virus. An individual may become a COVID case when they've contracted the virus after being exposed to it. Maybe they're symptomatic and taking steps to figure out if they're in fact infected, but maybe they're asymptomatic and have no idea that they're carrying the virus. The number of infected individuals adds up, forming the proportion of the population that is infected.
We will illustrate this proportion and others with a Venn diagram. The outcome of a case is either death or recovery. We can also visualize the proportion of cases that result in death as a Venn diagram. This is one metric we might be especially interested in to help us understand the impact of the pandemic. This is the case fatality rate, the proportion of COVID cases that die. If we could track down the entire population, the number of deaths and the number of COVID cases, we could calculate this rate exactly. But we don't have all the data.
For example, some COVID cases may go undiagnosed. A diagnosis would require an accurate COVID test. Availability of tests impacts the boundary between diagnosed and undiagnosed cases. None of the undiagnosed cases are reported. Only some of the diagnosed cases will be reported. As acknowledged by the paper authors, there can be many sources of imperfect reporting, including data errors, differing reporting guidelines, reporting infrastructure, and time lags in the transfer of information. Let's overlay these proportions over deaths and recoveries. Instead of having the true population number of deaths and cases, we only have diagnosed and reported deaths and cases. So we estimate the case fatality rate as the ratio of the striped maroon reported deaths and the dark blue reported cases.
The size of these two wedges depends on what proportion of the diagnosed cases are actually reported. If reports of cases and deaths were perfect, it would look like this. However, our estimate is impacted by the realities of reporting. The quality of reporting can affect both the probability of a death being reported given that it is a diagnosed death, and the probability of a case being reported given that it is diagnosed as a COVID carrier. However, these probabilities may be affected in different ways, impacting the overall ratio in different ways as well.
Though we always undercount the number of cases and the number of deaths, the degree to which we do so may differ. Therefore, the estimate of the case fatality rate may end up being too small or too large. The difference between the true population case fatality rate and our estimate is the bias of the estimate. What if cases are more likely to be reported than deaths? Then the ratio will be biased downward. We'll think the case fatality rate is lower than it actually is. But what if deaths are more likely to be reported than cases? Then the ratio will be biased upward. We'll think the case fatality rate is higher than it actually is. While unlikely, it is also possible that the probability of reporting a death given a diagnosis is the same as the probability that the case is reported given that there is a diagnosis. However, the biases cancel out in the ratio.
Bias doesn't just come from missing reports. It also comes from the time lag that results as information travels to us. Due to the nature of the phenomenon, A person doesn't contract COVID and get diagnosed at the exact same time. Similarly, cases aren't diagnosed at the same time as a death occurs. However, we make estimates of the case fatality rate with the information we currently have. If people have contracted COVID but have not yet been diagnosed, our estimate of the total cases will be underestimated. When cases are on the rise and the number of deaths is expected to increase, the case fatality rate is likely underestimated until these deaths actually occur. When we get an influx of reports, our estimates tend to increase, sometimes dramatically, but that is to be expected. The time lag bias is being corrected when reports catch up to us.
Suppose 25 people get sick at time t0. It takes until time t1 for some of them to get diagnosed, in this example 13. Between time t1 and the time that cases and deaths are routinely reported, which is time t reporting, some deaths have occurred. However, as time goes on, more of the infected cases end terminally by t outcome. At t reporting, the case fatality rate estimate is different than the case fatality rate estimated at t outcome. The paper proposes a method to adjust the case fatality rate estimate to specifically address the biases induced by time lags.
What if there was a way to get better reporting? Contact tracing is one way to minimize the number of undiagnosed cases. It's not just about who has COVID, we need to know how many people have it. Contact tracing is one way to catch asymptomatic cases. Otherwise, a person may never be motivated to get a COVID test if they feel fine. In a world of increased uncertainty, what do we have control over? Preventative measures such as physical distancing and wearing masks can reduce the number of cases overall. Similarly, improved medical treatments for severely sick patients can reduce the number of deaths.
We hope the information contained in this video will help you be more informed when you're consuming estimates of the case fatality rate of COVID-19. We've seen how specialists reason about bias and make estimates in the face of incomplete information. Even trustworthy information comes with uncertainty. We are Aleksandrina Goeva and
Sara Stoudt.
And we're representatives of the Harvard Data Science Review Early Career Board. Want more visual explanations like this? We're here to help explain content. Let us know what you would like to see.